Okay, so we're presenting on alterations in neuromuscular function. So this is baby Margot. She's a 1-month-old baby girl. She has two very loving parents, a dad who works full-time as a professional golfer, and mom works part-time as a personal trainer for professional athletes. And Margot has two older brothers.
So the symptoms that Margot is presenting with is severe weakness. She is not meeting her developmental milestones. She has a narrow sunken in chest, which is also known as a bell chest. She has a large belly. She is not reacting to outside stimuli. Her legs are fixed in a frog-leg positioning. She has difficulty breathing, and she's unable to latch onto mom when feeding, which is causing her to have poor nutrition. She's also struggling with excessive drooling and constipation. Our first question is based on Margot's symptoms, what would you want to assess first?
So for labs and diagnostics, a doctor ordered a blood test to confirm the suspected diagnoses, and that showed a high creatinine kinase levels. Vital signs showed the difficulty breathing with labored breathing, the low O2 saturation, and she was also tachypnic. And doctor also ordered an EMG, which measures the electrical activity of a muscular group, a muscle or a group of muscles. Results came back showing a generalized decrease in electrical activity.
So her diagnosis is spinal muscular atrophy or SMA type 1. This is also known as Werdnig-Hoffmann disease. It's a genetic disease that affects the central nervous system, peripheral nervous system, and voluntary muscle movements. It involves chromosome 5, and there is a massive loss of motor neurons in the spinal cord. Children who have type 1 typically have the lowest level of function. There are four types of SMA, and life expectancy is therefore shortened due to the associated complications. As I mentioned, there's like type 2, 3, and 4 are more in like teenagers and adults.
So, our nursing interventions and treatment. So, there is no cure for SMA, but there is a gene therapy. So, this is for children younger than 2 years of age, and it's going to prevent further motor neuron and muscle degeneration. There's a early initiation of physical therapy, and you want your child to be involved in exercise, stretching. There might be braces fitted to them and the use of orthotics. You want to do pulmonary intervention starting early in the child's life, such as chest physiotherapy, and they might need a tracheostomy for long-term support. And you also want to promote good nutrition, and that this could lead to a possible insertion of a G tube.
So our nursing diagnoses include the risk for ineffective breathing pattern due to her muscle weakness, risk for activity intolerance due to hypotonia, risk for poor perfusion due to the difficulty breathing, risk for malnutrition due to not being able to latch on to mom, and risk for caregiver role strain due to the intense medical regimen. Our next question is, what patient family teaching could you provide to try and avoid some of these risks?
So for family impact or social impact, Margot's parents expressed feeling very tired and overwhelmed with the care for Margot and making time for their other two kids. Her older brothers have said that they feel left out and like they always come second to Margot. And there's also a lot of expenses when it comes to this disease process. The gene therapy alone can cost $2.15 million for a one-time infusion. There's also considering hospital stay expenses, a possible at home nurse, and chest physiotherapy sessions. So our next question is, what community resources could you provide for Margot's family?
The outcome is Margot will stay as mobile as possible with the help of a home nurse and physical therapy. The one-time gene therapy infusion was successful for her, and the new focus is managing the damage that has already occurred, which can involve the continuous trach care, G2 management, and chest physiotherapy, and making sure that Margot lives as normally as possible with her loving family. I believe the last question we have is what might Margot struggle with as she gets older?